Cold open, direction, shot. Notes: medium close-up. Doctor faces camera directly. Clean, neutral background. No music. Calm, measured pace. On-camera dialogue. Diabetes is frequently described as a silent disease, one that advances for months, sometimes years, before a formal diagnosis is reached. What is less commonly understood is that the body often produces observable warning signs well before laboratory results confirm elevated blood glucose. Many of those signs appear in a single, consistently overlooked location: the feet. Introduction, credentials, and patient case. Direction, shot. Notes: widen to mid-shot, white coat visible. Cut to B-roll, doctor reviewing chart, patient in exam room. On-camera dialogue. My name is Dr. Richard Benn. I've been practicing internal medicine for over 20 years. Each week in my clinic, I encounter patients who have normalized symptoms in their feet, symptoms that, on closer examination, are directly associated with undiagnosed or poorly controlled diabetes. Last month, a 67-year-old man came in for a routine checkup. Before we ran a single blood test, I asked him about his feet. He had 4 of the 9 signs I am about to walk you through. His fasting blood glucose came back at 214 milligrams per deciliter. He had been diabetic for over 2 years without knowing it. Today, I want to show you all 9 of those signs, the clinical mechanism behind each one, what most people assume it means, and one daily habit that can help protect you. Prevalence and stakes. Direction, shot notes. Graphic overlay. 1 in 5 Americans with diabetes are undiagnosed, ADA. Cut back to doctor. On-camera dialogue. The American Diabetes Association estimates that 1 in 5 Americans with diabetes are unaware of their condition, more than 8 million people. That silent progression quietly damages nerves, kidneys, vision, and vascular tissue throughout the body. A $12 fasting blood glucose test can identify this at an early, manageable stage. But first, you need to recognize what to look for. Sign 1. Peripheral neuropathy. Tingling and numbness in the feet. Direction, shot notes. Close-up of feet. Cut to simple animation. Myelin sheath degrading along a nerve fiber. On-camera dialogue. Sign 1. Intermittent or persistent tingling and numbness in the feet, what clinicians term peripheral neuropathy. Patients routinely attribute this to sitting in one position too long. Occasional numbness from positional compression is normal. Recurring numbness without a mechanical cause is not. Sustained hyperglycemia damages the myelin sheath, the protective coating surrounding peripheral nerve fibers. As that sheath degrades, electrical signal transmission becomes inconsistent. That inconsistency is the tingling sensation. The American Diabetes Association reports that peripheral neuropathy affects nearly 50% of people with diabetes. It is the single most prevalent diabetic complication, and it almost universally begins in the feet. RX daily moderate intensity walking, 20 to 30 minutes, improves distal circulation and preserves peripheral nerve function. Concurrent reduction of dietary added sugars should begin immediately, not at a later date. Sign 2. Nocturnal burning pain in the soles. Direction, shot notes. Low ambient light suggests nighttime. Cut to nerve signal animation showing aberrant firing. On-camera dialogue. Sign 2. A burning sensation in the soles of the feet, most pronounced at night. Patients frequently attribute this to fatigue or prolonged standing. The clinical mechanism is entirely different. When peripheral nerves sustain damage from elevated blood glucose, they begin generating aberrant signals, transmitting pain impulses in the complete absence of any external stimulus. The brain registers heat or burning where none exists. The nerves are misfiring. Research published in Diabetes Care identified burning foot pain as one of the earliest patient-reported symptoms in individuals later diagnosed with type 2 diabetes, often presenting 1 to 3 years before formal diagnosis. RX, a minimum of 8 glasses of water daily, supports renal glucose clearance and peripheral nerve tissue health. Increasing dietary fiber, vegetables, legumes, oats, slows postprandial glucose absorption and reduces the cumulative burden on damaged nerve fibers. Sign 3. Impaired wound healing. Critical. Direction. Shot. Notes. Doctor speaks directly to camera. Deliberate, serious tone. B-roll. Minor foot blister. Graphic of narrowed capillaries. On-camera dialogue. Sign 3 is the most clinically consequential on this list. Pay close attention. Minor cuts, blisters, or abrasions on the feet that fail to close within a normal time frame are a serious warning sign. In the setting of chronic hyperglycemia, peripheral blood vessels undergo progressive narrowing and stiffening. Oxygen, white blood cells, and tissue-regenerating nutrients cannot reach the wound efficiently. The repair cascade is compromised. An open wound in a foot with impaired circulation is a significant infection risk. The Centers for Disease Control and Prevention reports that diabetic foot ulcers are the leading cause of non-traumatic lower limb amputations in the United States, more than 100,000 per year. The vast majority are preceded by a minor wound that was not appropriately monitored. RX inspect both feet thoroughly after bathing every day. Examine between every toe and across both heels. Any wound that is not improved within 48 hours warrants a call to your physician, not a scheduled appointment in 2 weeks, a call within that 48-hour window. Sign 4. Skin discoloration around the ankles. Direction. Shot. Notes. Close-up of lower legs. Cut to graphic showing reduced oxygenated blood flow in distal vessels. On-camera dialogue. Sign 4 is visible and hiding in plain sight. Patients often attribute darkening or reddish discoloration around the ankles to sun exposure or natural variation in skin tone. In some cases, that is accurate. There is, however, a specific pattern of discoloration that carries diagnostic relevance. When peripheral circulation is compromised, the lower legs and feet receive inadequate oxygenated blood. The skin reflects this deficit, darkening, taking on a dusky red or, in more advanced cases, a bluish hue. In some patients, the skin also thins and becomes fragile. A study in the Journal of the American Academy of Dermatology found that these cutaneous changes are detectable, on average, 18 months before a formal diabetes diagnosis. RX. 5 minutes of ankle circles, toe raises, and calf stretches each morning stimulates distal blood flow. For patients with limited mobility, elevating the feet while seated provides a meaningful, if partial, benefit. Sign 5. Chronic, treatment-resistant heel fissures. Direction. Shot. Notes. Close-up of cracked heels. Cut to diagram of autonomic nerve supply to sweat glands. On-camera dialogue. Sign 5 is the one that surprises patients most because it appears entirely harmless. Seasonal heel cracking is common and typically benign. What is clinically significant is cracking that persists regardless of season or that fails to respond to topical moisturizers despite consistent use. Diabetes affects the autonomic nerve fibers that regulate sweat gland activity in the skin. When these fibers are damaged, sweat glands in the feet lose their regulatory input. The skin loses its internal moisture source. No topical product corrects this root cause. Deep heel fissures represent a breach in the skin barrier, a direct entry point for bacterial pathogens, particularly dangerous in a foot with already compromised vascular supply. The American Podiatric Medical Association identifies chronic, treatment-resistant heel fissuring as a clinically significant indicator of autonomic neuropathy directly associated with long-term hyperglycemia. RX. Apply a quality moisturizer or pure coconut oil to the soles and heels nightly. Do not apply between the toes. Retained moisture in that location promotes fungal growth. Internal hydration, 8 glasses of water daily, is equally important. Direction. Shot. Notes. Doctor pauses. Direct eye contact. Relaxed tone. Brief departure from clinical register. On-camera dialogue. We are halfway through. If you have recognized any of these signs in yourself or someone you care about, leave a comment below. I read every one. If you're finding this useful, a like takes 1 second and helps this reach more people who need it. Now, let us continue.